Welcome to Mo Health Media. My name is Guy Danhoff, and today we have a very special guest. We are joined with Dr. Rachel Orscheln, and she is the Associate Professor of Pediatrics in the Division of Pediatric Infectious Diseases at Washington University and St. Louis Children's Hospital. And Dr. Orscheln, we just want to thank you for coming back. I know a year ago we were together, certainly talking about the first year as you were going through a great job with us, educating us about kind of that pathophysiology, if you would, about the infectious disease of COVID-19. Now, what we'd like to talk to you about is the Delta variant. So our first question is, could you give us any updates on the Delta variant as kids are now heading back to school?
Sure. And thanks so much for having me back. I really hoped we wouldn't be back together this
Right.
year. But here we are. So the Delta variant is one of the most recent variants to circulate in our community. And now you may be aware that the majority of cases of infection in most regions in the United States are caused by the Delta variant. And this variant has a few features that make it a variant of concern. And that includes that it appears to be more transmissible, or it passes from person to person more easily. And it has a little bit of resistance to antibodies or our immune proteins that protect us against infection. There is also some evidence that potentially in adults it may cause more severe disease.
Okay, so with that, let's also then talk about what about the vaccinations? So we know that there's been a strong encouragement to get more and more kids vaccinated. I was wondering if you could bring us up to speed on what's going on with the vaccinations for kids today.
Well, currently, vaccines are one of the best ways we can prevent infection with the novel coronavirus and prevent COVID-19. Currently, there is one vaccine that is available that has authorization for children down to age 12, and that's the vaccine produced by Pfizer and BioNTech. The Moderna vaccine has authorization for 18 and up, and as does the Johnson & Johnson vaccine. So we are looking at potentially authorization of the vaccine moving down into younger age groups as we move into the fall. It will likely be the Pfizer vaccine that is able to have authorization in those younger age groups. But we are hopeful that the vaccine will have, younger children will have access to the vaccine as we move into the fall.
And then could you maybe speak to if you've already been vaccinated about maybe having to get a booster? We've been hearing about that in the media. And what's your thoughts on that?
Well, currently, there is a recommendation that certain individuals, particularly those with immunocompromising disorders, receive a booster dose of vaccine. And that's because they have a less robust response to the initial 2-dose series. So now it is recommended that they have a third dose at least 28 days after their second dose. For the rest of the population, there is likely to be a recommendation coming next month that we receive an additional dose of the vaccine somewhere between 6 and 8 months after our final dose. And the reason for that is we do see a little bit of decline in protection against infection as we get further and further out from our vaccine, although it is important to remember that we continue to be highly protected against the most severe outcomes like hospitalization and death with the initial vaccine series.
Absolutely, and thank you for certainly give us some insight on that, because that's a very popular topic, as you know, in the news. So our next question is, this is a big one, vaccine misinformation, because there seems to be so much out there, and let's just be honest, the average person, including me, we're not sure what's up. And maybe if you give us a little more insight in terms of vaccine misinformation.
Well, it's hard because there is so much information out there, and that's why it's really important for people to go to reliable sources of information when they want to get information about healthcare. And so these are the sources of information we trust for many other things, and that includes going to the Centers for Disease Control and Prevention. The ACIP has good information on vaccines, and probably most importantly, talking with your own healthcare provider about the importance of vaccination for you and getting your questions answered, because that's really the best way to ensure that all your concerns are addressed in a really reliable way.
Well, that's a great answer, and I know that's something, because it is all individual. Different people have different reactions, as we know. You talked about that literally a year ago, last time I had you on the air. So you're exactly right, and that we need to check with certainly even our own physicians. So my last question is going to be this, And that is, I know it's a simple question, but yet, what do we not know that we need to know? In other words, there's so much information being put out by the media, and sometimes some things that are very important to us aren't being told. Could you maybe give us some insight into that from your perspective?
Well, particularly as it relates to school, we've learned a tremendous amount of information over the last year about how to operate schools safely. We know that with some very simple strategies, we can really keep kids in school and free of risk of infection. And those include things like screening students for any sign of illness and keeping students or staff home who are sick. Using face coverings. We know that this is highly effective in reducing the chances of transmission. And because of that, we no longer need to quarantine every child who has an exposure in the school environment if they're masked properly. Using some degree of physical distancing, using good hand hygiene, using proper ventilation, all these things can keep both teachers and students safe in school.
Well, Dr. Orscheln, we want to thank you so much. And we have this for our viewers. If you'd like to learn more, you can go to learn more about our MOAAP toolkit, as well as our upcoming vaccine toolkit webinar. That can be found at our Mo Healthy Schools website. And we're also going to post this recording with Dr. Orscheln there as well. So, Dr. Orscheln, again, we want to thank you for taking the time and bringing us up to speed on everything that's going on with the Delta variant as well as the vaccines.
Thanks so much for having me today.